Dr. Becky Kgole is a pulmonologist. We've asked her to share South Africa's challenges with the disease and as well as the advances that the country has made in battling TB. Dr. Becky, thank you so much for your time. Today being World TB Day, how should society at large take into account around why this day is being commemorated?
Thank you very much for having me, Bongiwe. I think the first thing that we need to do is to just be aware of how common the disease is and how easily it is spread around, and how we can at least prevent ourselves from spreading it and from getting it from the community around us. For instance, TB is a disease that you get from droplet spread, much like the COVID was being publicized before. And we all could protect ourselves by wearing masks, staying away from crowded places. TB is spread in much the same way. And unfortunately, it is the person who has TB who has to make sure they don't spread it and they don't go around to places where there are crowded places, and they get themselves tested and they get to be on treatment.
All right. And Doctor, in the past few days, we have done a lot of trying to understand who is most likely to contract the disease, as well as the socio-economic factors. But please talk to us about some of the advances that have been made in terms of treatment, as well as prevention programs, as well as campaigns, or even strategies. The world is a fast-paced, as well as technology-driven and futuristic. Any new news to share around this front?
In the past couple of years, so initially TB was diagnosed on sputum, and you had to wait for your sputum to be sent to the lab and for the microbiologist to grow the bacillus and then have a look at it, stain it, and then give you the results. So that took a bit of a long time for you to get your results back. So we've got the Gene Expert Ultra, which is obviously you get it from the lab. You still need sputum. But the turnaround time is easy. It's shorter. You can get your results back in a matter of hours. So it is just important to go and get yourself tested. So that's the one thing. The other thing is that TB treatment has now, and it's not even recent, in the past couple of years, easily 15, 20 years, has been combined into a single drug. So if you weigh a certain weight, you're going to take 4 of them, but you don't have to take 3 of them or 4 of them or 5 of them, depending on your body size, but you don't necessarily have to take 3 or 4 different tablets. So because of that, the compliance is easier, and the taking of the TB treatment, you only take it once a day. So it's easier to comply and take it appropriately. Mm-hmm. So I think those are quite good developments in how the community can take their TB treatment and how quickly they can get diagnosed with regards to TB.
Now, Doctor, as a pulmonologist, what challenges do you have in the global fight against TB, especially as we commemorate this day across the globe today?
It is as simple as getting tested. So when people are coughing and they've been coughing for over 2 weeks and they've got weight loss, they still don't come to the healthcare providers early enough for them to be tested for TB. So if we could just get past letting the community know that if you're coughing for too long and you're losing weight, and you've got night sweats that wake you up in the middle of the night with your bed sheets wet, you should be getting tested for TB to prevent you from, one, having side effects or adverse events from not treating your TB, and also from going to the community and spreading it even further. So those are the challenges that we've had for years. Those are the challenges we continue to have. But we're hoping that as we do celebrate days like World TB and we take TB knowledge into the community, we should be able to curb the number of people that are not being tested.
All right. And speaking of communities, Doctor, then how can they, as well as healthcare centers, collaborate to increase awareness about TB, including, of course, early detection and treatment?
What they're doing at local clinics, which are the first port of meeting with healthcare providers, is as you're sitting in the queues and you're waiting for your treatment for other diseases that maybe you are being treated for, the nurses and the healthcare workers there at the clinic usually have health talks about whatever disease that is common at the time, and whatever they've got programs in which they try to share the knowledge with the community. The other thing is, I believe that we should take this knowledge to schools, much as we did with HIV in the beginning when it started, where schools were being taught about TB, and you had groups, whether it was at school, debating teams, people used to come and just get people to get to know about HIV and getting tested. I think if we did the same thing about TB and other common diseases in the country, we should be able to get through to a lot of people and help them in knowing where they should go, what they should do, and reducing the time it takes to diagnose and to get treatment.
Doctor, thank you so much for your input this evening. Dr. Becky Kgole, the pulmonologist, with some insight on TB as we commemorate World TB Day today.